Hello everyone. So we are once again we are welcoming you all to our session. That's a post natal module where I already told you that we will be discussing a few cases from each module. So today I'm going to focus on postnatal module where we picked up two cases. So that will be today. This time it will be mastitis, postpartum mastitis, and then next we will be discussing another problem. So here let me tell you a brief introduction. I would like to say about the postpartum problems. See, they can arise. See, once the woman delivers, and so we may have obstetrician may not have much work, much responsible, but still they can problems can arise in the postnatal period also. And especially the mother, because baby will be looked after the pediatrician mostly. So problems can arise, like they can include you also can get this type of cases in the exam. So postnatally, what problems you can expect? That is, these are the problems which you come across commonly in your day-to-day life. Maternal collapse, it can come in the as a case similarity patient task, or as a in the labor ward prioritization. Then return placenta, postpartum hemorrhage, and then the perineal trauma is very important. Third degree, fourth degree tear are very common, very important. Even episodic also they can ask. So that comes as a structured discussion also. Then infections in the mother, then their management they will ask. Then mastitis and contraception. Sometimes they give with the breast cancer and contraception in the postnatal period. So you need to discuss. And wound infection like vulval hematoma, for example, vulval hematoma and broad ligament hematoma can occur with the forceps delivery. Also can occur in the cesarean sections. Psychiatric problems, that is postnatal mental, perinatal mental health. You can get like blues, postpartum blues or depression, bipolar disorder. So these are the things which you can expect. And bladder problems. And this is about the mother. And then coming to the baby, then what you need to know in the postnatal period, you need to know how is the baby. So you need to ask the baby how is the baby's condition. When you see the woman in the postnatal period rounds, during rounds, you ask about the baby, congratulate her, and ask the name of the baby, whether she is breastfeeding or not. Breastfeeding is very important. So baby and breastfeeding, how is the baby and are you breastfeeding? Then coming to the mother, any abnormal bleeding, means excessive bleeding or foul smelling discharge, any bowel, how is about the bowel and how about the bladder, whether she bladder open, bowel opened, and bladder problem. So these are the things which you have to ask in the postnatal period. You have to look into. And then now coming to the what all things you have to see in the history, like details of the presenting complaint in the postnatal period. Whenever she comes with any problem, like in this case, this is the mastitis. So they can come with postpartum headache also, postpartum pulmonary embolism. These are the things. So you come, they can develop these problems when they are in inpatient, not before discharge, or they can go and come back with the problem. So then details of the presenting complaint. And then delivery, you always see the delivery notes. After the presenting complaints, see the delivery notes. You would like to take a permission and ask her whether can I see your delivery notes, because you would need to know what happened exactly during the delivery. And antenatal details, you need to ask her what about the briefly about she had any problem in the antenatal period, like whether an increase in the blood pressure or increase in the sugars, or whether she had any clots. So then and whether she was on any medical treatment. And then here no need to ask about the gynec history. And because gynec history, we are not going to, unless she comes in the postnatal visit. When she comes in the postnatal visit at 6 weeks, then you have to ask whether she got a period. That's at that time. And that time you need to discuss the contraception. So now it's not important. Then you need to ask whether she had any similar history in the past. Suppose any present condition she has now, then whether she developed this condition in the previous pregnancies also. If she had any previous pregnancies, medical history, you need to ask whether she is on any medication, like for example thyroid medication or epilepsy medication, whatever whether she is on, and you have to ask her to continue. And then family history, briefly about the family history, same diabetes, hypertension, and clots. That is then social history. Then just you can ask about the BMI. What's the BMI and whether she's smoking. Usually we take the social history at the time of booking. But if she still is not quitting the smoking, which is very rare, we have to tell her to quit the smoking. And BMI is very important. Sometimes they give in the cases and case scenario, and sometimes you need to ask because obesity is very important risk factor for thrombosis, for thromboembolism, and also mobility and all the issues will come. Then you have to ask a mental health, two questions about the postpartum to check her mental status. You have to just ask to rule out depression. How do you feel as a mom as a newborn? Do you feel any issues? I mean, is there any issue when is there any difficulty to get adjusted to the new life? So just to want to know whether any postnatal she is going into depression. Now, then when we are meet at 4, then she will be given at the time of discharge. She will be asked to come at the 6 weeks postnatal checkup. That time you will be advising her about the periods, whether they have started, and about the contraception. So you'll be advising about. Now, after now at present, when she is admitted or when she comes, you need to, after history information gathering, then you have to ask anything to add, which I always tell you, whether you would like to add anything. After that, you need to go for the examination, whether, because postnatal we need to examine her, because her pulse rate, blood pressure, temperature. If they are given given it along with the case scenario, no need to do repeat. But if they are not given, you have to check. Then you will say, you will ask the nurse to check the blood pressure, pulse rate, and temperature, and you will check the abdomen for uterus, whether it's involuting or not, and whether there is any tenderness. And tenderness means whether she is developing any infection, and local examination, specific speculum examination, to know whether loci of they are normal or excessive bleeding or any abnormal discharge. So then coming to this is about the examination, then investigations, whether she has done any investigations, otherwise whether she requires anything depending upon the case scenario. Now coming to the applied clinical knowledge, that is, you're going to explain her condition. So sometimes you need to draw and show. Always whenever it is required, you have to draw and tell her, explain to her our investigations if they are there. If it is done, you explain to her. If the observation findings are there, explain to her. And after confirming name, age, and NHS number, which is very patient safety point of view, it's very important. And also you have to explain to her condition, about the condition and the management. Always in the management, give her management options. Not one option, you cannot decide one option and say one option. You give her options, and then give her this thing to autonomously to decide by herself. And whatever she says, you have to respect. And every option you have to give risk and benefits. So then sometimes at the time of discharge, you have to say whether this condition is recurrent or not. In that case, you tell about the recurrence, you tell about the breastfeeding she needs to continue, and contraception advice. So, and then she has to communicate with the GP, her GP or her midwife, or any home visitor. So this is very important, because her care will be taken over in future after discharge from the hospital. She'll be taken care by the nurse, midwife, who can come for the home visits, then health visitor, and also GP. So these are the things which you should keep in mind. Now, with this introduction, I will go ahead with the present case. This is a case of postpartum mastitis. So here, this is a simulated patient task to assess the following clinical skills. So you need to take the information gathering, take care of these domains, communication, whatever they gave, look at it. Communication with the patient and patient safety, and applied clinical knowledge. Here, communication with the colleagues is not that much important. So now you are an SD5 register. Always you are SD5 covering postnatal ward today. The midwife wants you to see Mrs. Mary Matthew, a 30-year-old woman in the postnatal ward. She had a vaginal birth assisted with the forceps, and this is the third postnatal day. She is complaining of pain and swelling in her right breast. She is taking paracetamol and codeine. She is waiting for her discharge. Naturally, we discharge at third day, but because the midwife found this thing, so she informed you. On examination, we have the observation findings. Temperature, that's 7.5, and then blood pressure and pulse rate are given. The normal BMI also is given, which is normal. And the examination findings are given. So that is, the right breast is swollen, tender, and red. No fluctuation. No fluctuation means no abscess. Then flat nipple. Flat nipple, sometimes the examiner want to deviate your attention. So flat nipple they mention. So then sometimes it will be difficult for lactation also, latching also. So that also is, but flat nipple, when you see, you will get deviated. So these are the things which you should remember. Quickly you remember, you can write down in the notebook, notepad also, which is provided. Now you have what you should do. You gather relevant information and then take targeted history, what is relevant to the present situation, answer concerns, outline management. Now I'm starting the station. So hello, introduce yourself. Always introduction is important. Hello, I'm Dr. Manjula, one of the doctors in the postnatal ward. Am I talking to Mrs. Mary Matthew, 30 years? Because she's admitted. Again, I have told you before also. Because she's admitted. Am I talking to Mrs. Mary Matthew, 30 years? Yes, doctor. How may I address you? Can you call me Mary, doctor? So, First, then you say congratulations because she delivered. Many congratulations on the arrival of your baby. How is the baby doing? Did you name her baby? Are you breastfeeding the baby? So these are the things which you should ask about. Initially, I told you. Now, coming to this just introduction. So now coming to the agenda. See, Mary, I could see that you have delivered 3 days before, and now having pain and swelling in your right wrist. So you are taking for that, you are giving pain relief medication, that is paracetamol and codeine. Am I correct? Yes, doctor. Is there any relief of pain from these medications? No, doctor. Still, I have pain. I'm not getting much relief. But then, can you tell me more about your concern? So always put an open question. So she will start telling what is her problem. So can you tell me more about your problem? So she will say about the pain. So what you have to address is when did you see whatever she tells about the pain. So what things you should note. When did you start? When did the pain start? The time, duration, that is. When did the pain start? Do you have pain in other breast also? Because now she says right breast. Then do you have a pain in the other breast also? Any fever? Because now it is temperature is normal, but before whether she had any fever. Then any lump? Did you notice any lump in the breast? Any swollen glands in the armpit? And any discharge from the nipple? So she will say whatever she has or not, she will say. These are the questions related to this scenario in this station. And because of this, you ask any difficulty in breastfeeding because she has pain. Any difficulty in breastfeeding because you have pain? And did you see any poor latching? Any issues with the bladder, that is passing when water works, or bowel open? Did the bowel open? And now you have to ask about the postnatal. Now you have asked about the breast condition. Now you need to ask the postnatal condition. What that is whether bladder she passed urine and whether bowel opened and any pain in the tummy and then any pain in the legs and any unusual bleeding, any foul smelling discharge. These are related to the delivery, not to the present case. It is related postnatal because it's postnatal. You need to ask. So initially you will ask a history of present illness. Then you will ask related to the postnatal period. Now delivery details. Now coming to the delivery details of the present pregnancy, you want to know. So I could see that you had vaginal birth and using with forceps, using instruments like forceps. Any cut was? Can you tell me whether any cut was given down below? That is episiotomy. Any if cut is given, you want to know whether there is any pain, any soreness. Do you feel any soreness there? If it is given soreness, can I see your notes? You want to see the notes. Always notes. So now coming to her antenatal period history, just brief word about the antenatal. Can you tell me about your pregnancy? How was your pregnancy? Did you have any issues like increase in the blood pressure, increase in the sugars, or any clots? Any problem with the suppose it is the previous pregnancy, she had previous pregnancies. You say, did you have face any problems with the breast during previous pregnancy? Or do you have any problem with the breast in the before pregnancy? That's non-pregnant status. Anytime any issues you had with the breast? So this is about the present pregnancy. Now, previous pregnancies, if she's not, is it your first pregnancy? If she says yes, that's all. No need to ask about there's no need to ask previous pregnancy. If she says no, she had 2 deliveries, then you say, how are the deliveries? Normal delivery or cesarean section? Then how is the whether she delivered term or preterm? Second thing. Third thing, how is the baby at the time of delivery? And also, how was her recovery? 4 things you have to ask. So that's all. Now coming to the gynec history, usually no need to ask the gynec history. It's not relevant here. Medical history, you need to know whether she is on any medication. Sometimes they will be on a thromboprophylaxis or sometimes they will be. So usually you ask her whether she is on any medical regular medication, any allergies. Do you have any allergies? Then any surgical history also is not important here in the past, whether she had any surgeries. That's also not that important. Any family history of any concern? Whether she had any family history of blood pressure or increase in the sugar or in the any clot formation. Then how social history, how do you feel? Now her mental status you want to know. How is the mental status? So first thing is you ask about the how is the support at home, because she is postnatal, she needs support to look after the baby and to look after the mother also. How is the support at home? And then how do you feel as a new mom? Are you coping up with this new situation? Sometimes they can't cope up, they become depressed and the postnatal blues. So these are the things you should ask. And also, because the BMI is mentioned here, you say, I see that your BMI is 25. So then no need to ask what is your BMI. So be careful with all the points given. So now moving on to the explaining her about her condition. What is the condition? From the case what is given there, you know that it is a mastitis, because then you, according to that, you have to ask the questions and tell the management. So now because examination findings are given, so now you are going to explain to her. So Mary, let me explain to you your condition. I could see that your examination findings are here. Your observations are stable. Your observations are stable. Your examination findings are given. And so from your history and examination findings which are given here, that is, you have a condition called mastitis. Mastitis in the medical terms. That means it is an inflammation of the breast. So that is, breast is engorged, swollen, and red. And red and nipple is flat. So this is what is called this condition, swollen, red, and this thing. And so it is flat. And then have you heard of? So this is about mastitis. Have you heard about it? Usually the people will know because they go to the internet website and see all this knowledge they have. Have you heard about it? And then it becomes easy also for you to explain. No, doctor, I don't know anything about this condition. And some role players may say, yes, I know. So whatever she says, it may not be same answer in every station. So now let me explain to you the condition what you have. So now let me draw and show you. So I'll explain to you. In this condition, the breast, there are small channels which open onto the nipple. Your nipple, there are small channels. When baby presses the nipple, then squeezes, the milk comes out from these channels. So sometimes what happens, some parts of the breast may not drain well during feeding. Then that causes milk to stop flowing, and because it's not drained, and this leads to blocking of the channels and leading to accumulation of the milk, which causes inflammation of the breast. And this condition will causes fever, pain, swelling, and it feels red and hot. The breast feels very red and hot, and sometimes you can feel the lump also. So let me tell you, it is not infectious. It's not infectious. It's not an infection. So it is not an infection, and it is also common condition. It's also a common condition. Doctor, is there any treatment for this? Because I'm having a lot of discomfort. So, and I want to feed my baby also. Can I feed my baby? So you say, now I shall address your concerns and explain to you exactly how to manage. So Mary, I will inform my consultant. First, I will inform my consultant. And also I will inform the breastfeeding specialist, a specialist midwife, who can come and help you. And also the baby doctor. I'll inform the baby doctor. He also will come and see to see whether baby is doing well. And because you have this condition, sometimes baby may not be able to suck properly, and baby also can become unwell also. So baby doctor also will come and see. Now we have how to manage. I will tell you. We have some general measures. Then some medications. We can give you some medication. So let me tell you about the general measures which you can do. That self-help measures. So am I clear so far? Shall I proceed? Yes, doctor. So now you can continue. You have to continue. You can continue breastfeeding, because breastfeeding you need to feed more frequently. Whenever you feel breast is full, you need to feed more frequently, and because it helps in emptying the accumulated milk. This is the quickest way of having relief. So then second thing is, you feed more on the sore side first, because that breast is more engorged. So that side you feed more, and because it will help the breast drain the breast. So am I clear? So this is one thing. Second thing, what you need to do, you can apply some hot compression to the breast, and also take shower with the warm water. Then this relieves your pain, and also it will help in milk flowing freely. Third thing what you can do is, if still you have discomfort, then gentle massage. You do the gentle massage, and you feed in different positions. See whether in particular positions the feeding is better, and also check the position and attachment. And if any difficulty you found, and there's any difficulty, then you can contact a breastfeeding specialist, a midwife, who can come and help you. She will tell you the right technique. Because nipple also is flat, there may be difficulty. You may face difficulty. So she'll help you. Then the other thing is, what we can do is, we can express milk. You can express the milk either by hand or breast pump. This will effectively remove the milk. And also whenever the baby refuses taking feed, because it is difficult for the baby to get the milk from this engorged breast, sometimes this will help. So then, other than these feeding techniques, you keep yourself hydrated, take plenty of water, and you wear well supported well supported bra. And also, this is about the general measures. That is your self-help measures. Then other thing is medication. About the coming to the medication, because you have pain, we will give you some pain. Already you are getting pain relief medications. That is paracetamol. That is safe. Let me tell you, it is safe in breastfeeding. But the other thing what you're taking is codeine. We cannot give you for a long time, so we need to stop it. And because it can cause some breathing problem to the baby, and baby can become drowsy. So we will stop that medication. Now, coming to the doctor, do I need any antibiotics or anything? Any other extra medication? No, now you don't need any antibiotics as it is not looking like there's no infection now. No need for any scan also. And then because she will get worried also, she doesn't know what is this condition, so she'll get worried, and no need of scan also. So but because you have this problem, and we'll delay the discharge, we will not discharge you now, and we will delay it for some time, and we will relieve with these measures. We will see whether you get some relief and you become comfortable, and we'll review after few hours. And then with these measures, with this conservative management, and if there is any improvement, then we will we will not give any other medication. We will discharge you. But whether if the condition worsens, if the fever you develop, the pain increases, and the fever you develop fever, then baby also becomes unwell. Then we will not discharge you. We will start the antibiotics, and then see whether the pus has formed. Whether there is any pus formation, then in that case we may have to go for the some small procedure to remove the pus. So am I clear so far? Yes, doctor. So now, once you are comfortable, I told you we will be, and you can continue breastfeeding, and we will discharge you. But I'll give a contact, we'll give a contact number, 24-hour contact number. Anytime you feel after going home, anytime you feel fever or increasing pain or feeling unwell or some abnormal bleeding or abnormal discharge, or baby is not becomes unwell, then you need to come to the emergency. So that means it indicates that you have developed some infection. So, and possibility of developing pus collection, that's called abscess. So we will, when you come, we will check, examine and see whether there is any pus formation. That time we will start the antibiotics. And antibiotics, let me tell you, the antibiotics which are safe are given. And sometimes they may cause some like fluoxetine, and sometimes they may cause loose stools to the baby. So am I clear? Do you have any other concern? So this is the way to end the station. So I'll be around here. I'll then this is an information leaflet. You can go through it. If you do have any concern, you can inform our nurse and she'll contact me. I'll come in, address all your concern. So now, whenever I'll inform my consultant also, and we'll take you forwards like this. So thank you. Then thank you for talking to me, Mary. And at the time of discharge, we will advise you what to do. We'll be giving you the discharge advice. So thank you for speaking.